Good evening, friends. We are back in our Facebook Live session. Today is the World Patient Safety Day, and as a doctor, I think it's my responsibility to educate our fellows, our nurses, our junior doctors, and overall community on what is patient safety. Whenever our near and dear is in the hospital, we are always anxious about the safety of our patients. We are worried whether our patient is getting the right treatment or not, whether the drug is being delivered at the right time, are the healthcare providers, which includes doctors and nurses, taking care of our patient, or I would say taking enough care so that our patient or our near and dear comes back home. So these are all questions in any relative's mind, and the same questions have always been questioned in the minds of the healthcare workers, in the minds of the hospital management, and also in the minds of the doctors and nurses. Because patient safety is of paramount importance. When a patient is in the premises of the hospital, it becomes the utmost responsibility of the hospital to actually take the best possible care for the patients, and also the most important responsibility of the doctors, which we take in the form of Hippocratic oath, is that to first do no harm. So, doctors, the healthcare providers, nurses, and hospital caregivers are involved and working as a team to prevent any harm to the patient. And that comes as what we call as patient safety. Now, there are certain patient safety goals which every healthcare organization always vouches to go for. But before that, I will share some data that a lot of time there are harms which are done to the patients, not because of I would say negligence, but a lot of time it is also because of the most of time because of the patient factors, and it can also because of the environment factors, and also because of the healthcare factors. But if you want to really take the patient safety goals to the highest quality standards, first of all, we have to identify the accuracy of the patient, or we have to identify the right patient. There can be two patients with Sandeep Dewan, there can be four patients with Ankur in the hospital. So that is why, for utmost patient safety, every patient is given a unique identification number whenever they are in the hospital. Names can be same, age can be same, gender can be same, but every patient is identified by the unique number, and that is why that is of utmost importance that we are identifying the patient in the right way. The second most important piece of the patient safety goal is to improve the effectiveness of communication among the caregivers. For example, if there are multiple caregivers involved in the care of a patient, all the healthcare providers have to talk to within each other to make a comprehensive care plan for the patient, and also communicate the same to the family. The third important patient safety goal is to improve the safety of medications that are being delivered to the patient. We all know that medications have to be given by a standard dose, in a standardized way, with a standard route, identifying the right site, the right drug, the right dose at the right rate. So that is why, to maximize the effect of medication and to minimize their side effects, it is very important that we follow the medication safety guidelines, and we try to minimize the medication errors to as much extent as possible. The fourth important goal, which is becoming very, very relevant in India, is to reduce the risk of healthcare associated infections. In India, we are the hub of, I would say, infections, particularly which we call as superbugs. And most of the superbugs in India are dreadful, and they contribute a lot to the morbidity and mortality. But a lot is there beneath the iceberg. I would strongly suggest my community friends to not gulp antibiotics without the advice of the doctors. It has become a habit among the community to actually first take antibiotic, and after 3 days, if they don't improve, then they show to a doctor. You're only harming yourself by self medication. You're only harming yourself by self medicating with antibiotics, because ultimately, what will happen when you really need that antibiotic will not work for your body. So, it's important to decrease the risk of healthcare associated infections. Similarly, in hospitals, there are certain isolation rooms. The infrastructure changes are made in such a way that each patient who needs a certain type of healthcare environment is given the right environment. There are isolation rooms, there are barrier precautions, there are airborne precautions. Different kind of diseases requiring different kind of healthcare infrastructure, and that is what the host of the hospitals actually vouch to do. So reducing the hospital infections is a very important piece of patient safety goals. The other important is to maintain proper records and diligently and accurately note down all the patient details. The sixth part is to decrease falls of the patient. We have seen, particularly in old age, whenever the patient is coming out of bed wishing to go to a washroom, there can be a fall leading to a bony injury or a fracture, which can significantly decrease the contribute to the morbidity. And that's why we have protocols in place, that we should have protocols in place to prevent a patient fall. So if I were to say, the last patient safety goal is to actually have very good infection control practices in the hospitals, in the clinics, in the nursing homes, and I would say and maintaining a very good hygiene at your homes. So that's why it's very important that we take infection control precautions. Hand hygiene protocols are in place. Hand washing is done very, very frequently. And the last thing, we have to actually have special emphasis that our doctor colleagues don't write abbreviations. We have to write the drug as it is. Don't abbreviate. Don't write short spellings. Write completely, right dosage with right medications. So that is the way we can actually give a very, very safe environment to our patients. We can give more confidence to our patients. Most of the hospitals in India are on, particularly those which are accredited hospitals, whether they are NABH or JCI, they all have these protocols in place. So I would say that the community people, our community friends, should be satisfied that in India, the hospitals, the healthcare providers, the doctors and nurses follow these patient safety goals and try to give the maximum care to our patients. Most importantly, we still believe in the dictum, first do no harm. With that, I end this deliberation and will meet you again in some other session of Facebook Live with a fresh new topic. Thank you very much.